Hello, my name is Claire Schilousky, and today we will be discussing some of my experiences included in my capstone portfolio and about older adult depression. So let's get started. Depression of older adults in Nebraska developed into a public issue as statistics are analyzed and the mental health movement progresses. I chose this issue because it is often overlooked by Western society. Oftentimes, Western society looks down on their elders as confused, lacking wisdom, and helpless, when the reality starkly contrasts this stereotype. Depression among Nebraska's older adult population is important to me because of the frequency I see it personally and professionally. Becoming an educated citizen has assisted me in connecting personal experiences to public issues by shaping the way that I advocate for people around me. Being an effective communicator encompasses communicating with patients, no matter the obstacles. During my time working as a nurse aide in a rehabilitation facility, I worked with a young woman that was left mentally and physically disabled from a car accident as a teen. Loud sounds often frightened her. While the bed alarm was necessary, it was obnoxiously loud. While getting her sat on the edge of the bed one day, the bed alarmed, and I fumbled to turn it off as a new nurse aide. The patient quickly became overwhelmed, and I did not think that saying something as simple as, "You are okay," calmly, would soothe her as well as it did. I squatted to her level, put my hand on her knee, and she said, "Thank you. I needed you to tell me that I was okay." We went on to finish her transfer after she calmed down, and she had a wonderful day. This experience taught me that one of the most important aspects of connecting with my patients is to make them feel understood. Communicating and connecting with patients comes in many forms. Understanding how to modify communication to the needs of each of our patients is a necessary skill for working with the variety of patients that nurses see every day. Older adults with depression are often misunderstood. They have additional risk factors that make them more likely to become depressed. It is important to assess and educate patients about these additional risks that are associated with aging, such as loneliness, changes in physical ability, and chronic health conditions. Connecting older adults with resources that make older adults feel understood and cared for, such as groups and services such as the Friendship Line, is an important part of combating depression in older adults. This next experience is invaluable because it was the first time that I was able to witness a life or death discussion between provider and patient. My patient had been hospitalized for 2 weeks, endured 2 exploratory laparoscopies, and the surgeon wanted to perform another. All evidence indicated that her small bowel was still perforated, and if it was going to be fixed surgically, it needed to be fixed soon before there was too much swelling from previous surgeries to operate. This patient had enough of the pain and other restrictions associated with abdominal surgery. She wanted to be able to do as she pleased and drink as she pleased. She was adamant about not wanting any more operations. The surgeon explained the consequences of not doing another operation. "It might be a small hole that fixes itself," he said, "or it might be big. We can wait and see if it heals, or we can do another surgery in the next couple days." It seemed like the surgeon explained the same thing for at least 10 minutes. The patient listened, but bluntly refused to have more surgeries because she was already in so much pain. The surgeon was matter of fact with the cascade of events that would follow: sepsis and death. The surgeon patiently discussed the consequences of refusing surgery multiple times during his visit, and eventually asked the patient and her son if they had any questions, and left the room so the patient and her son could discuss their options. Talking with, educating, and discussing options with patients is not a new concept. It has been taught plenty of times. However, this experience shocked me into reality more than I expected. It takes repeating the same things over and over for some people to fully comprehend what is going on and what the options are during these high-stress times. It was a great experience to see the surgeon have so much patience with his patients. Although this experience wasn't about my own communication, it was a great experience to see because the verbal communication was stellar, as well as nonverbal communication that the surgeon used as he knelt beside the bed and held the patient's hand during this difficult conversation. Seeing firsthand how good verbal and nonverbal communication can change an experience from awful to a little bit better is exactly what is needed for some older adults with depression. While this experience was situational, Older adults with depression might need a listening ear and to really feel heard. Loneliness and loss of loved ones is a prominent risk factor of depression in older adults, and it is important to understand the cause of depression in each patient and treat accordingly. I believe that part of being a good nurse is knowing what it's like to be on the patient's side. Reflecting on your own experiences as a patient or the loved one of a patient helps prevent desensitization. My experience was during the height of COVID-19 restrictions, but in a way, I am glad that I was not allowed to see my dad after his motorcycle accident. After 5 trauma surgeries in the first week, a month in the ICU, and 2 weeks at a rehabilitation facility, he was discharged home. This sounds like the end of the story, but it is the beginning of my half of the story. Dad was beginning to move to a new apartment when he wrecked. My brother and I moved everything into the new apartment, but my dad wanted to be the one to organize everything. So he came home to stacks and stacks of boxes. Luckily, he was discharged just as I was starting my winter break at school. So I could stay with him while he learned how to function as a newly wheelchair-bound in this very, very unorganized space. I knew that Dad would not handle this conglomeration of hardships well by himself, so I volunteered myself for 2 months to help him eat enough, cook, clean, support him mentally and emotionally, as well as help organize his new apartment. It was a very large undertaking, to say the least, but I will never regret enduring that with him. Stepping up to this responsibility was a serious decision, but I almost immediately knew that I was going to be staying with Dad after he discharged home from the hospital. This experience taught me that I have the ability to make decisions rapidly if needed. It also taught me that I can withstand an incredible amount of stress. Taking care of my dad was not merely waiting for physical independence to return. I was also staying with him to care for his emotional and mental states by being present, engaging in conversation, and reconnecting with him. Reflecting on this experience made me realize that I was trying to provide holistic care for my dad throughout his experience. Focusing more on holistic care for older adults with depression would improve many issues seen in the older adult population. Caring for the whole patient instead of a single problem would improve outcomes greatly. Another experience that made me intensely reflect on myself was interviewing for my very first registered nurse position. Interviewing before developing confidence as a nurse is difficult, and as someone that tends to excel during interviews, I was surprised when I left my most recent interview feeling absolutely defeated. After reflecting, I realized that my director, urging me to apply early, gave me a false sense of confidence in myself, when I knew that I was unconfident in my nursing abilities to begin with. Working in an ICU as a nurse aide is awesome because we get to see so many bedside procedures and other cool things. However, working as a nurse on an ICU is a completely different mindset. Unfortunately, I realized this and I did not have time to process those nerves until after this interview. But luckily, my managers that interviewed me are understanding and told me to reapply for the position after my preceptorship on the ICU when I am more comfortable and more confident in my skill set. This experience taught me that I needed to be more reflective before diving headfirst into critical care. In the last few months, I have continued to examine my abilities as a new nurse. I decided that if my ICU preceptorship goes well, then I will pursue working in critical care. Reflecting on these experiences will be crucial to the safety of my future patients, as well as my own satisfaction as I transitioned into a new nurse. Older adults with depression may need to reflect on the root cause or causes of their depression. Talking with a mental health professional can help organize thoughts and discover what is causing such unhappiness. Seeking help can be very beneficial, even if it's just talking with someone for an hour a week. Reflecting on your experiences regularly is helpful in finding strengths, weaknesses, and ways to improve your quality of living. Becoming a change agent has been the most difficult part of becoming an educated citizen for me. At the beginning of the COVID-19 outbreak, parents were terrified, and many took their children out of daycare services. Because of the financial strain that this put on the daycare facility that I worked at, we had to combine age groups. For example, the ages that I became responsible for were infants and early toddlers. Before COVID, each age or developmental stage were separate, and it worked very well. Having infants and early toddlers in the same room was not safe, to say the least. Toddlers were stumbling and falling near the infants doing tummy time, and it became very difficult to safely promote the physical and mental development of each of these age groups simultaneously. Despite advocating, brainstorming, and discussing options with management, we had to wait for enrollment to return to near the baseline before re-separating infants and toddlers. This experience taught me that sometimes nothing you do to advocate for change will make a difference. I can feel good about myself because I spoke up and I tried to enact change for a safer environment for these kids, but nothing was done in response to my coworkers and I sharing safety concerns with our bosses. Despite the little change that comes from advocating sometimes, it is important to remain steadfast and keep trying to get changes made. Older adults with depression may be unable to afford care or are unable to access it for some reason. Working with patients so they can get access to affordable care regularly is important. Advocating to change a system that leaves so many behind is a small step now, but hopefully it leads to leaps in future care. Another example of acting as a change agent was when I was at work recently. I assisted with an ICU admission that needed a Foley catheter placed. The assigned nurse asked for my assistance, and of course I was happy to help. The patient was conscious, but on CPAP, so she was quiet for most of the time. The nurse, who was very professional most of the time, was openly discussing how much she hates placing catheters. Overall, the way she was talking was not appropriate in front of a patient, and I assisted however I could during this catheter placement. But the nurse's dislike for placing catheters carried over into her practice. I had to speak up and say that we should get a new catheter after the nurse repeatedly tried to reinsert when she missed the urethra, among other contaminations. But another nurse came in afterward to try again with a new catheter, luckily, and much better sterile technique. After cleaning up and leaving the room, I stopped and talked with the first nurse about how she was talking. She agreed that it was not professional. She was just having a bad day, and she was just a bit more open than she should have been in that patient room. This experience taught me that being a change agent can be very uncomfortable. I do not like confronting people anyway, so speaking up about this was like hiking with too much supplies, if you know what I mean. I know that I will have to get more comfortable with being uncomfortable in nursing because we have to advocate for our patients. And this experience proved to me that I can be an advocate for my patient and everything can turn out okay. I learned that calmly confronting someone about a patient's care can be the simplest yet the most effective solution to a problem. Utilizing this for older adults with depression would include encouragement to look at the patient's situation holistically. What risk factors does the patient have? What changes in their life have taken place recently and had a significant impact? Speaking up to care, Speaking up to providers and professionals to advocate for our patients is the key to helping our patients achieve overall well-being. But this is like climbing a mountain, and I need to develop clinical confidence first. Becoming an educated citizen throughout my education at Methodist has been a trying experience. It challenged me in uncomfortable ways, but reading through my past reflections has shown me that I have grown immensely in the last 2 years. Taking these experiences and applying lessons that I've learned to a broad issue has demonstrated my ability to think critically about public issues that are seen today and solutions to these problems. It's exciting for me to think about how much I'll experience and grow in the following 2 years as I transition from a novice nurse into a professional and competent nurse. Thank you so much.